On the rib cage, you see that the rib cage obviously is made up of the ribs, the articulating cartilage, and the sternum on the anterior aspect. If we consider just the sternum for a second, this bony plate here is going to essentially be made up of three parts. The superiormost part is the manubrium, followed by the body or the gladiolus, and the inferiormost part, this sharp pointy process here, would be the xiphoid process. Notice that the head of the rib and the tubercle of the rib are all going to be posterior, and you see the shaft of the rib making its way towards the anterior aspect and articulating to the sternum via the articulating cartilage. Now, as far as the ribs go, there's going to be 12 altogether. The first 7 are going to be considered true ribs. The reason they're considered true ribs is that they each have a one-to-one articulation to the sternum via this costal cartilage. 8, 9, and 10 are false ribs. You see that they all share this segment of costal cartilage. And 11 and 12 down here are considered false ribs as well, but also floating ribs, because there is no costal cartilage connecting them to the sternum. Right? So their main function is kind of to support, well, to protect the kidneys that would normally be back here. So that's kind of the rib cage and the sternum. As far as the general anatomy of a rib, if we focus on this rib, you have again the posterior aspect where the vertebrae would articulate. You have the head, making your way kind of lateral to the head. You would have the neck, and this rib is kind of difficult to see the neck. So head, neck, and then lateral to that you would have the rough tubercle. And so that rough tubercle is what would articulate with the transverse facet on the thoracic vertebrae. As you move lateral to that, you would have the angle of the rib, where it starts to angle and move the shaft anterior. And if you look at the inferior border of the shaft of the rib, you see that depression there where it kind of thins out. This is the costal groove. And in life, this costal groove would allow blood vessels and nerves to move along the inferior margin of these ribs. So identify the costal groove. This is a quick way of determining left versus right on ribs. As long as you point that costal groove inferior and you realize that this is medial, you can determine that this, in this particular case, is a right rib. I think that's